Natural pain relief for dogs. Arthritis in dogs, how to help. 1. Start your dog on glucosamine-type supplements at the first sign of arthritis, or even before. 2. Keep your dog lean to reduce wear and tear on her joints, and encourage moderate exercise that doesn't make lameness worse. 3. Use an anti-inflammatory diet and natural supplements to control arthritis pain before resorting to drugs. 4. Maintain a health journal for your dog to record which treatments you try, at what dosages, and how well they work for your dog. Osteoarthritis is the #1 cause of chronic pain in dogs, affecting 1 in 5 adult dogs, with the incidence more than doubling in dogs 7 years and older. It is a degenerative disease that causes pain, loss of mobility, and a decreased quality of life. Dogs can develop other types of arthritis too: rheumatoid arthritis, septic arthritis, spinal stenosis, spondylitis, or spondylosis. Signs of arthritis in dogs include stiffness when getting up or lying down, limping, slowing down on walks, pain after exercise, or reluctance to jump or climb steps. It's important to recognize the signs of arthritis in dogs and begin treatment early, to slow the progression and help preserve your dog's quality of life. Find a complete list of dog arthritis symptoms and risk factors by reading Identifying Arthritis in Dogs by CJ Puotinen. So, your dog has just been diagnosed with osteoarthritis. Now what? To start things off, here are the do's and don'ts. How to treat arthritis in dogs. Do get a definitive diagnosis. Use diet and exercise to take extra weight off your dog. Want a complete list of anti-inflammatory foods? We like this one. Just make sure you're not feeding your dog anything that's potentially toxic, like large amounts of garlic or onions. Maintain exercise but change long walks to more frequent, shorter walks. Consider nutrition. The best dog foods for arthritis are papaya, alfalfa, celery, and ginger. Raising water and food bowls can reduce strain in the neck or back of an arthritic dog. Some arthritic dogs may not eat or drink as much as they should without this sort of accommodation. Note, however, that raised bowls are contraindicated for dogs who are prone to bloat. Ask your veterinarian whether your dog is at risk for bloat. Put carpet runners on hardwood floors. Try to prevent your dog from slipping, as this creates unwanted stress on the entire body. Provide a soft, supportive bed. Keep nails trimmed. If nails are too long, they can change the gait on the dog, causing skeletal changes and arthritis in the foot toes. Use a ramp where needed for helping your dog get in and out of the car, onto your bed or sofa, etc. This will reduce strain on his knees and hips. If your dog is having trouble getting up or walking on his own, check out slings, rear-end harnesses, wheelchairs, or carts to help keep him moving. Consider physical, laser, and massage therapy, acu-puncture, and dog arthritis supplements. All or a combination of these will improve the quality of your arthritic dog's life. Don't self-diagnose your dog with arthritis. Force an exercise regimen that your dog is not comfortable with. Try any stretching of limbs without being properly trained. Discontinue exercise. A certain amount of exercise remains important for your arthritic dog. It is necessary to help maintain muscle strength and mobility. Ignore your dog's extra weight. Your dog will feel so much better after taking that extra burden off sore joints. Ignore sliding or falling. Don't underestimate how damaging continual sliding and falling can be on the arthritic dog's body. Give any medication without veterinary approval. When my dog, Piglet, was diagnosed with severe dysplasia in both elbows at a year old, I was told that even with the surgery we did, she would develop arthritis in those joints. I gave her a daily glucosamine supplement, but knew of no other way to help her. By the time she was 6, she was on daily NSAIDs, non-steroidal anti-inflammatory drugs, such as Remedies and Remedies, to relieve the pain that otherwise caused her to limp. At the time, I thought I'd be lucky if she made it past the age of 10 before becoming too lame to walk. Arthritis in dogs. It was then that I learned about the benefits of a natural diet, and began researching dog supplements that I could use to improve her condition. I switched her onto a raw, grain-free diet just after she turned 7, and within a few months, she no longer needed any drugs for pain. As time went on and her joints continued to deteriorate, I tried more and more supplements and natural therapies, rotating between those that seemed to help, and replacing those that didn't seem to make a difference. I was able to keep her off drugs until she was almost 12, then began adding them to her nutraceutical cocktail. The net result? At age 15, her elbows are visibly deformed and vets cringe when they see her X-rays, but she still enjoys 1 to 2 hour walks every day. She no longer runs, but jogs along at a comfortable pace. I let her decide how far and how fast we go so that I don't risk pushing her beyond her limits, but occasionally I have to convince her it's time to head for home when we're miles away and she still wants to keep going. Following are the arthritis treatments that have helped my dog, and others like her.